Good afternoon, everyone. My name is Tamir Barkley, and today we will be talking about the environmental determinants of breast cancer in women in urban Kerala, India. We will explore the key risk factors that are associated with breast cancer in Kerala women and the challenges they face. And we will also look at the potential interventions that can help improve breast cancer awareness and prevention. So, breast cancer is the most common cancer among women worldwide, and in Kerala, its incidence is significantly high. Kerala, which is India's second largest urbanized state, and it has about 47.7% of the population living in that state alone, shows this trend of increasing incidence in breast cancer. So Trivandrum, which is Kerala's capital, it has the highest crude incidence rate in India, 40 per 100,000 women. What does this mean? It means that on average, 40 new cases of breast cancer occur annually for every 100,000 women in the population. There is 35% of breast cancer cases that occur in women under 50. And normally, women have a high mortality rate because they wait until the cancer is at an advanced stage for them to be diagnosed. This is a health problem analysis for Kerala, India, and it shows the direct and the indirect contributing environmental factors as well as the modifying and non-modifying risk factors. We will dive into this some more. So let's look at factors contributing to breast cancer. So breast cancer development is very complex. It is influenced by a mix of factors. So these can be broadly categorized into genetic and biological factors, psychological, behavioral, and external factors, and physical environment, which can be divided into direct and indirect factors or effects, rather. So let's look at some direct environmental risk factors. So direct environmental risk factors include exposure to toxins like heavy metals and radiation, and the effects of urban heat. You have water contamination and them living near industrial areas. Some indirect environmental risk factors include factors such as broader issues like industrial pollution, poor air quality, pesticides, exposure through food, workplace hazards, poor sanitation, and inadequate healthcare infrastructure. So it is important to differentiate between non-modifiable risk factors, which we cannot change, right? Such as age and genetics. And the modifiable risk factors now are the ones which we can address through lifestyle and environmental interventions. So the importance of addressing modifiable risk factors, we need to focus on modifiable environmental risk factors because it is crucial for public health interventions. And as I said before, non-modifiable risk factors, which we cannot change, therefore, public health efforts rather must prioritize addressing modifiable environmental risk factors so that they can reduce breast cancer incidence. So I did a SWOT analysis and I'll do a breakdown of the strengths, the weaknesses that they face in Kerala State, the opportunities that are there to improve awareness, and some threats. So Kerala has its strengths to build upon, right? And some of these strengths include high education levels, they have available treatment centers, they have existing awareness programs, and they also have medical research advancements. Some weaknesses now that need attention include limited awareness of environmental risk, the stigma that is around screening, because there is this thing in Kerala state or India on a whole, uh, such as the social and political stigma that is attached or surrounded by breast cancer. So women don't feel open and, comfortable to discuss these issues. So there's also high treatment costs and they have insufficient environmental policies. So some opportunities to strengthen these issues can be they need to strengthen their health education, they need to implement stricter environmental regulations, they need to expand screening access, and they also need to improve urban planning. Some threats include increasing urbanization and pollution, right? And industrial residents, they have funding limitations and socio-cultural barriers which hinder early diagnosis. So we're going to now look at some communication strategies, that we can use to disseminate the information to spread breast cancer awareness in Kerala, India. So effective communication is very crucial, and messages, should be clear, concise, avoid overly complex language, and it should be tailored to the socio-cultural context of urban Kerala. So some communication platforms that we can use, as I said, to disseminate this information, we need to reach the target audience rather. So to reach urban Kerala population, effective platforms include digital and social media, radio and television. So it's a mixed or multi faceted approach. So we need primary care physician communication, health center and community initiatives, and some government and non-governmental led programs. So let's look at primary care intervention or integration, for example. They can have awareness programs during checkups. For community health initiatives, they can have free breast cancer screenings. The government and the non-governmental initiatives or organizations, they have this program or this organization called the Kudum Bashiri Women's Empowerment Program. They can utilize this or strengthen this organization to help spread more awareness or spread awareness at a better rate. So this is some do's and don'ts of breast cancer prevention. This is a brochure that was created using Canva. So to minimize breast cancer risk, it is important to follow these do's and don'ts and focusing on, their environmental risk reduction and healthy lifestyle choices. So some do's include, regular exercises, eating a balanced diet, supporting policies that reduce industrial pollution, and some don'ts, we need to, or they rather need to focus on lowering the consumption of excessive processed foods, and they need to ensure that they do not ignore early warning signs and ensure that they check for any persistent breast changes. So in summary, environmental risk factors play a significant role in breast cancer development in urban Kerala, and effective prevention requires clear communication, targeted intervention, and a comprehensive approach which involve policy education and communication and community engagement. Sorry. This is the end of my presentation, and these are the references.